Now, wait a minute here. How can you lose up to 8 or more inches off your waist but not lose weight? Well, consistent with the previous evidence in animals and in humans, increase in muscle. Mm-hmm. So you ladies know that as we age, we lose about a third of our muscle. Mm-hmm. So you see little old ladies and guys with skinny arms and legs. They're frail. They can't go upstairs. They have to use a scooter, all that stuff. Mm-hmm. Well, we see a restoration of youthful muscle. So you know what? It's the exact opposite of Ozempic face.
Welcome to the Clear Skin Chronicles, the podcast that takes you on a journey to uncover the secrets of achieving glowing, acne-free skin. We believe that knowledge is power, and by understanding the root causes of your acne, we can create a solid foundation for long-lasting clear skin. I'm Katie Stewart, registered holistic nutritionist and founder of the Clear Skin Solution, where we help women just like you get to the root cause of their acne.
And I'm Chris Brown, registered holistic nutritionist and program director in the Clear Skin Solution. Through functional testing, we pinpoint where the body system imbalances lie so we can dive deep into your acne clearing journey.
We work virtually with clients to clear up their skin from the inside out and have helped thousands of women worldwide regain their confidence. So I'm kind of having a little bit of a full circle moment today on the podcast. I'm so excited. Both Chris and I are so excited for our next guest, Dr. William Davis. And I say this is a full circle moment for me because back in 2011, before I was a nutritionist, when I was still eating that standard North American diet, not understanding why I had migraines and stomach aches and skin issues and joint pain and all of the fun things that I was told were just normal, I found out I was celiac. And a colleague of mine gave me a book called Wheat Belly. And if you're watching on YouTube, you can see that I've had this book so long that the pages have started to yellow. And this was actually one of the very first nutrition books I ever read. And now I have New York Times best-selling author, cardiologist, Dr. William Davis on the show, the author of Wheat Belly and Supergut. So Dr. Davis, thank you so much for joining us today.
Oh, thank you, Katie. Thanks for having me. Thank you, Chris.
Yeah, Chris and I have been talking about this for a few weeks. We've been really looking forward to it. We love your book. And Chris and I were just talking before you hopped on, it's a really easy read, Supergut, your newest book, Supergut. For the average person, it's really easy to understand because a lot of these books can be really complicated and the average person may not understand the terminology, but you've done a really phenomenal job of breaking it down and making it very easy to digest.
Thank you.
The analogies. I have an inner geek in me. I love it. Katie's the outside face and I'm like the inner, right? So I just want to commend you on that because those analogies really connect everything for people. And like Katie said, easy read with a lot of valuable information.
Mm-hmm. Thank you, Chris. Nice, good feedback.
Yeah, I think everybody should read it because it's such a profound book that can be so insightful. So let's I wanted to talk about, the microbiome as a whole. Of course, we're going to get into the impacts of the skin and acne and those, side symptoms that a lot of acne sufferers have. So Dr. Davis, I would love for you to, really help us break down what's happened to our gut's microbiome in this industrial revolution and how it's really been quite different from what our ancestors' microbiome has looked like.
Sure, Katie. So we've been exposed as a society to so many factors that are disruptive over the composition of microbes in our gastrointestinal tracts, pardon me, as well as elsewhere, by the way, in the skin, in the airway, in the reproductive tract, the female reproductive tract, the bladder. Who would have guessed the bladder has a microbiome? We thought it was sterile. It's not sterile. But all the things we've been exposed to as a society, multiple courses of antibiotics, preservatives in food that kill microbes like mold in food, but also kill microbes in you, emulsifying agents in ice cream and salad dressing, compounds like polysorbate 80 and carboxymethylcellulose and carrageenan, emulsify your intestinal barrier and thereby disrupt the microbial composition, acid-blocking drugs, stomach acid-blocking drugs, anti-inflammatory drugs like naproxen and ibuprofen, chlorinated drinking water, on and on and on. We swim in a sea of factors that disrupt the microbes. And among the casualties is we've literally lost hundreds of microbial species including some very, very important species that were doing good things for us. A lot of the most beneficial species, like my favorite microbe of all, for a variety of reasons, including, by the way, skin, is Lactobacillus reuteri, and we've lost it. It was the German microbiologist who discovered it in 1962, Dr. Gerhard Reuter, isolated it from the breast milk of a German breastfeeding mother. And he found it easy to find in breast milk and stool. In his 40-year career, he found it increasingly more difficult to find that microbe, such that he couldn't almost find it anymore after 40 years. And this remains true today. If you look for it, you're going to find almost nobody has this very important microbe that has all kinds of health implications: skin, bone, muscle, libido, reproductive organs, emotional health, and we've lost it.
It's incredible. I know when I was reading your book, I thought some of the really interesting facts that people would be surprised to know is that even the changes in your microbiome can be impactful for things like preterm labor.
Yes, isn't that something? Oh, there's a whole new world. Now, there's a lot more to talk about for females than there is for guys. The male microbiome conversation really needs to advance further, but ladies are a lot more complicated. But you're right. There are changes in the reproductive microbiome for ladies. Loss, for instance, of the microbe, very important, Lactobacillus crispatus. About a third of the world's female population has lost that microbe. And when you lose it, you're more prone to candida infections. You're more prone to, as you say, miscarriages, more prone to premature labor, more prone to urinary tract infections and vaginal dryness, which becomes a real problem for older women, like in their 60s. And restoring it has spectacular effects. How about Bifidobacterium infantis, that if a pregnant mom has it, passes it on to her child at delivery and breastfeeding, that child is healthier. There's better neurological maturation, higher IQ, less likely to have asthma or obesity or type 2 diabetes later in life, and able to draw from all the nutritional value of human milk oligosaccharides in breast milk. So there's so much in the female reproductive health with regards to the microbiome. Now, one of the great tragedies, though, is you'd think baby formula would be the smartest, most effective product on the planet, right? Because it's so important. No.
Nope.
We're all on team no here.
Yeah.
All on team no.
Yeah, it's really fascinating is, something Chris and I both tell to our clients is your current health status really is an accumulation of everything that's happened from conception up until this moment in time. And I find that's really eye-opening for a lot of people because you don't realize the connection between the health of the mom as she's pregnant with their growing baby and even how the baby is delivered and brought into the world.
We've really mucked it up, haven't we?
Yeah, convenience. I always say we're a prime Amazon type person. My children don't know what it is for a commercial. Even if there's a commercial on their YouTube, they're like, oh, we need a subscription. I can't listen to this 10-second. They're like, what are you doing, Mom? And I'm like, it's just an infomercial. And they're like, I said, listen, it used to be 90 seconds when I was a kid. I can handle 15 seconds. So, what I love that you addressed in the book is cesarean sections and being able to go and book those because it's a convenience method. I'm not talking about the emergency because absolutely time and place for everything. But when you book your own child's date for convenience, we have to step back and look at that microbiome, look at what we could potentially be losing, not in judgment, but in quality of health. Fair?
What's interesting is a lot of these things, you and I, we were all given hints at a lot of these effects, but didn't see them for what they were. You always think about vitamin D. It sat on the side of your milk carton for decades, and we didn't recognize that it's one of the most important things people can do for health. Well, likewise, if Chris says, hey, I want to deliver my baby on Wednesday, August 23rd at 8 a.m., well, how do you do that? She comes into the hospital, they put an IV in, they give you an infusion of oxytocin, Pitocin. That's the brand name, but it's oxytocin. And that provokes uterine contraction and cervical relaxation, and Chris delivers her baby, right? not knowing that that's a hint at the huge role that this wonderful hormone oxytocin plays in overall health, but also reproductive health. So it's responsible for the uterine contraction and delivery of a child. It's also responsible for being able to express breast milk. So a lot of ladies have trouble breastfeeding, and one of the reasons is the loss of the capacity to produce oxytocin, because we lost the microbe that provokes oxytocin, Lactobacillus reuteri. A lot of ladies struggle with postpartum depression. That's a low oxytocin state. So many facets of female reproductive health, delivery, post-delivery, are affected, impaired by the loss of Lactobacillus reuteri, and thereby the loss of oxytocin. And I also think a lot about this. Now, wait, so oxytocin, the hormone of love and empathy and sociability, and we've lost that microbe, thereby oxytocin, at a time of record suicide, record social isolation, divorce, 50% of all marriages, right? And I wasn't aware of this till recently. The psychology community has been formally tabulating, measuring the narcissistic behaviors in people since 1963. And the increase in narcissistic behavior has sharply increased. It's a 45-degree upward climb since 1963. True or false? 1963. I am a very important person in this world. 1963, 13% of people said, yes, I am. Our time, it's more like 83% of people. Now, it's not just reuteri and oxytocin. There's other reasons, capitalistic society. And
I can think of a few right now, yes.
But it's something we can do something about. We can restore this microbe lost by nearly everybody, regain that empathy, generosity, better control over reproductive behavior and breastfeeding and mood after delivery. And also, oxytocin is also the hormone, I call it the hormone of body composition. It determines how you look, where you have muscle, where you have fat, the texture and the look of your skin has so many effects. That's just one microbe. There's many other microbes, but the Lactobacillus reuteri. If your listeners walk away from this with one message, that is, recognize the incredible power of this one microbe, Lactobacillus reuteri. Reuteri, by the way, is Reuteri, like the Reuters news service. It's German.
Yeah, it's actually one of the strains we specifically look for in probiotics for our skin or our acne and skin clients because it has such that profound effect. And Dr. Davis, with acne, of course, there comes a whole slew of other symptoms because acne is never really just one symptom that the individual is experiencing. Something that Chris and I see a lot with our clients is we're dealing with mental health issues. They're dealing with anxiety. They're dealing with depression. They're on, SSRIs. And it's really fascinating when you start to pull back from that eagle eye perspective and you look that it could all be connected right back down to those missing microbes in their gut.
Absolutely. Excellent point, Katie. So you're right. Losing hundreds of beneficial microbes oddly allows fecal microbes. These are microbes that are supposed to live in your colon, and the colon's perfectly fine doing that. But these fecal microbes like E. coli and Salmonella and Campylobacter, which may sound familiar because they're also the species of food poisoning. So these fecal microbes, because you've lost beneficial species, have been allowed to ascend into the small intestine, into the 24 feet of small intestine. Small intestinal bacterial overgrowth, SIBO, we say. Well, the small intestine is, by design, very permeable because that's where you're supposed to absorb amino acids and vitamins and minerals. And so, but when fecal microbes gain access and colonize the small intestine, when they die, they only live for a few hours. When they die, they release some of their toxic components from their cell walls into the bloodstream. That's called endotoxin. And when endotoxin gains access through the very permeable small intestine into the bloodstream, that's called endotoxemia. That explains how microbes, disrupted fecal microbes in the small intestine, can be experienced as eczema, rosacea, psoriasis in the skin, or in the brain as depression, anxiety, cognitive impairment, suicide. or in muscle and joints as fibromyalgia or rheumatoid arthritis. So now we have an explanation and scientifically validated and corroborated numerous times now how gut microbes influence the skin. Another aspect of all this, when you have fecal microbes invading your small intestine, you lose even further. You lose beneficial microbes. Beneficial microbes are those that produce butyrate or butyric acid, which has many wonderful effects like reducing blood pressure, reducing blood sugar, better sleep, better dreams, etc., and better skin, because that butyric acid. So you ladies may know, healthy skin is acidic, has a pH of about 4.5. And someone who's got acne or eczema or psoriasis, they have a pH of about 5.5, less acidic. So as you recall, the pH scale is logarithmic. So the difference between 5.5 and 4.5 is tenfold more acidic. Well, when you get microbes, when you bring back order in your GI tract, reduce those fecal microbes, restore healthy microbes that produce butyric acid, some of it goes to the skin, acidifies your skin, and it reduces the populations of Staphylococcus aureus, which is a familiar pathogen, and encourages proliferation of Staphylococcus epidermidis, a beneficial microbe. And you thereby gain moisture, reduction of redness, reduction of blemishes. So you're right. The GI microbiome, for so many reasons, plays a big role in skin appearance and health.
And this really is the gut-skin axis, what we're discussing.
Yes. Now, another thing I like to weave in, though, is, we've been given terrible advice on diet, right?
Yes.
Cut your saturated fat. Think what that did for you, right, Katie? Eat more healthy whole grains. Not a mention made of the people who have got celiac disease and other forms of intolerance to wheat and grains. Well, when you go wheat and grain free, there are additional benefits on the skin. But one of the things that happened when we were given that advice was most people in North America abandoned consumption of organ meats. Tongue, brain, stomach, intestines, heart. That means the intake of collagen and hyaluronic acid dropped to very low levels. So we're supposed to get lots of collagen and hyaluronic, because those, I know your ladies' focus is skin health. So you know that collagen taken orally increases dermal collagen. Of course, the seat of skin health is the dermal layer. So collagen peptides increase dermal collagen, increase the thickness of the dermal layer. And by the way, it also rebuilds joint cartilage and the collagen in your arteries. And collagen is very glycation prone. It gets damaged every time your blood glucose goes above 5 millimolar, 100 milligrams per deciliter. And it becomes irreversibly damaged. And that's why people get crepey skin and thinning of the dermal layer. Now you can rebuild that by getting collagen. Hyaluronic acid is so interesting. I know lots of ladies put serums around their eyes.
They spend all the money on all the serums. Myself included.
So I asked her, well, okay, you put it around your eyes. What did it do for your skin on your neck or thighs or buttocks or abdomen? Nothing, of course. So let's get hyaluronic acid orally that you would have gotten had you eaten brain or skin or tongue. And hyaluronic acid also adds to dermal collagen. It stimulates dermal collagen production. It also increases moisture content of the dermal layer. So hyaluronic acid is incredibly good at retaining water, not edema kind of water, but healthy location water in dermal layer. And incredibly, hyaluronic acid is rare in that it's a fiber. Most fibers we get from food, from plants. But here's a fiber that we get from animals. And this fiber causes proliferation of those butyrate-producing species like Akkermansia and Fecalibacterium and Lactospiraceae. And it also suppresses fecal microbes. So oral hyaluronic acid, better joint health, synovial fluids made of hyaluronic acid, better arterial health. Arteries are lined by something called a glycocalyx, a signal molecule made of hyaluronic acid. So heart health, joint health, and skin health for a variety of reasons. So this thing abandoned. People say, I bought boneless, skinless chicken breast. They threw away the skin that contained the hyaluronic acid. So you weave
Because
in
it's bad
hyaluronic
for
acid.
your heart, right, Dr. Davis? It's bad. It's full of saturated fats, right? This is what's coming up. I know I chuckle too, but I'm being very facetious
But
here.
being a
But
cardiologist, I'm sure
that's
you've
why I like it.
I think hyaluronic acid is a terribly neglected factor in heart health.
Hmm.
That'll come to light over time. Another thing that's happened is, your friends and family probably order food from fast food joints, right? They get their food brought by Uber or Lyft in a clamshell. You don't even know how that was made. You don't know what oil was used. It's not organic, right? One of the problems that emerges from this reliance on processed and ultra processed foods is the dramatic drop in carotenoid intake.
Mhm.
Beta
Yeah.
carotene, lutein, zeaxanthin, cryptoxanthin, and astaxanthin, and several hundred others.
Mhm.
Well, when you do that, you lose control over skin health and body composition. So restoring carotenoids protects you from sun damage. It partially reverses existing sun damage. It shrinks your waist and has very potent anti-inflammatory effects. There's a suspicion that there's something called inflammaging, the
Mhm.
inflammation of aging. Astaxanthin, one of the few things that suppresses a carotenoid. It's the most potent carotenoid of all, astaxanthin. That's the carotenoid in like salmon. It's the pink in salmon and lobster. It is incredibly anti-inflammatory. Now, I did a small clinical trial where relevant to skin health, because I know your listeners are interested in skin. And I restored Lactobacillus reuteri. I threw in marine sourced collagen peptides, marine sourced because it's effective at lower doses than bovine and porcine, hyaluronic acid, 120 milligrams, and astaxanthin, 4 milligrams. And 25 ladies, we asked them, please don't change your diet. Please don't change your exercise program. We're going to take a look at your skin. And we do such things as high resolution skin ultrasound to measure the dermal thickness.
Mhm.
Ladies were pleased. After 90 days, their dermal layer increased 15%. Most of the time, if you take just collagen, you'll get like maybe a 6 to 7% increase in dermal thickness. So we're seeing 15%. So twice. That's 90 days, probably more over a long time period.
Incredible.
We didn't go beyond 90 days. So 15% increase in dermal thickness. Ladies were happy because a lot of them lost crow's feet, lost smile lines. Some started to see a reduction in the nasolabial fold and forehead wrinkles, as well as other parts of the body too.
Mhm.
But to our surprise, we also measured waist circumference. This was a skin clinical trial, but we
Interesting.
measured waist circumference just because it's free.
Why not?
And, and the
Added
ladies,
bonus.
so no change in diet, no
Mhm.
change in exercise, dramatic reduction in waist circumference.
Wow.
Now, even more interesting, as much as 8 inches. Even more interesting, they didn't lose weight. Now, wait a minute here. How can you lose up to 8 or more inches off your waist but not lose weight? Well, consistent with the previous evidence in animals and in humans, increase in muscle.
Mhm.
So you ladies know that as we age, we lose about a third of our muscle.
Mhm.
So you see little old ladies and guys with skinny arms and legs. They're frail. They can't go upstairs. They have to use a scooter, all that stuff.
Mhm.
Well, we see a restoration of youthful muscle. So you know what? It's the exact opposite of Ozempic face. Right?
It's the better Ozempic face.
So those people pay $12,000, right, for
Mhm.
Wegovy or whatever,
Mhm.
and they lose 40 pounds, say, 10 pounds of which is muscle. And those drugs are specific more for subcutaneous fat, less for abdominal fat. So they lose 40 pounds, yeah, and look 10 to 20 years older. And by the way, when they stop the drug, because most people can't afford that kind of money forever,
Mm-mm.
they regain 32 to 34 pounds of fat, almost all fat, almost no muscle. And they're actually more at risk for type 2 diabetes, heart disease, cognitive impairment, dementia, and breast cancer, higher risk than they were at the start. So I think we have a way of so what we're really doing is restoring things lost. You lost reuteri. You're not getting collagen. You're not getting hyaluronic acid. You're not getting carotenoids like astaxanthin. You restore them. Not only do you have better skin, thicker dermal layer, reduction in blemishes and sun damage, but you also restore youthful contours.
Incredible. All from repairing your microbiome, getting the collagen, the hyaluronic acid, the zeaxanthin, and none of these people had to go to the spa and get Botox and fillers and facials and Ozempic and all of the things that our society tells us we need in order to, have that anti-aging effect.
You ladies know that they inject hyaluronic acid
Mm-hmm.
as filler in the face, as lubrication in joints. So there was all these hints that things like hyaluronic acid have astounding effects, but few appreciated that the real benefits come from adding it back to your diet.
And what's interesting, Dr. Davis, is so often we hear our clients say, my doctor said my diet has nothing to do with how my skin looks. But you're here to officially break that myth for us that 100% the things you're eating are going to make or break how your body and your skin is working and functioning.
Absolutely. It's crucial. It's critical to skin health. And so as you two know, your efforts can include lots of topical products.
Mm-hmm.
But you can't expect full restoration of skin health, dermal thickness, anti-inflammatory protection from inflammation. You can't expect that by relying only on topical products. You got to address diet. You have to address factors lost in modern life.
And another thing I would love to touch on is, Chris, what we see time and time again is the majority of our clients. Chris, what would you say would be the percentage of our clients that have taken long-term antibiotics for their acne and were told that this was their only solution?
We're well into the 90 percentile. Well, because it's deemed as bacterial, it's deemed as acne fighting. However, as Dr. Davis said, let's step back. Let's look at the cultures. Let's look at the pH balance of the skin itself. What are we doing to feed it? Let's look at the lipopolysaccharides, their LPSs. Okay, and all truth be told, if you have children in the car right now, you might want to turn me down. But LPSs, I call them little pieces of shit because of what they do inside the body, right? I don't know, Dr. Davis, if this is PG. I think I just did that. But I really look, it's that endotoxemia that you talk about. It's the catastrophic breakdown. It's a fact that the standard North American diet is high in silica, and silica is the predisposition mineral of silicone. And fine, that we're just going to pump in these, but that's going to disrupt that collagen availability inside the body, right? So it's not just a matter of going and pumping ourselves full of supplements and pumping ourselves full of maybe just a diet. The fact is, it's the entire lifestyle balance. It's understanding what works. It's transitioning, right? It's, Dr. Davis gave us a lot of things to say, hey, I did a clinical trial, and how many people stopped, rewound, wrote it down, and are on their way right now to a health food store to get exactly all of those things, right? However, if you don't know how to be monitored and do, then at one point when you come off these supplements, Dr. Davis, what's going to happen if we don't start transitioning the rest of it, right?
Yeah, so these are not permanent effects. It requires ongoing effort, but it is an illustration of the incredible power of both the microbiome and its effects on skin and overall health, but also the power of restoring things lost from the human diet, like collagen, hyaluronic acid, and carotenoids. I was also talking to my friend, Dr. Kiran Krishnan. He's a microbiologist. He's the guy that started Microbiome Labs.
Great company.
Yeah, he was behind the Megaspore Biotic thing. I was talking to him just a couple of days ago, and they have very good evidence that restoration topically and orally of two microbes, Bacillus subtilis and Bacillus coagulans, has dramatic effects on acne, and they're going to extend their science into other sorts of rashes too, like rosacea and psoriasis and so on. And that's not a drug, so we can't say these things out loud often. But they're seeing dramatic effects on skin by restoring or by using these two spore-forming microbes also.
Yeah, I really do love Microbiome Labs. I actually have a bottle of that exact probiotic sitting on my table over there. And for you, when we're looking at all of the different strains of those probiotics, of course, there's a lactobacillus in the Bifidobacterium, but there is also this other category of the spore or the soil-based probiotics. Could you give a little bit of insights into those?
Very interesting class of microbes. I should point out some of the critics, though, of probiotics. There's a lot of issues with probiotics, good and bad. Some people say they don't survive stomach acid or bile. They do, especially, not all of them do, but two of my favorite microbes, Lactobacillus reuteri and Lactobacillus gasseri. Those are two really important microbes. They survive stomach acid and bile very easily. And that's how they colonize the small intestine. So the loss of those two microbes in particular may be a big part of the explanation why there's so much SIBO now, because those two policed the small intestine. They colonize the small intestine, they produce bacteriocins, natural antibiotics effective against fecal microbes. We lose those. Fecal microbes have been given an open invitation to colonize your small intestine and have all those adverse effects. One spore-forming microbe is very interesting, Bacillus coagulans. And now we're using I'm sorry about these strain designations. You ladies know the strain designations are kind of a pain in the neck, but it's the GBI 306086 strain. That strain, it's a spore. It's like a seed. It germinates in the small intestine and then releases its own bacteriocins. And by the way, I've done this combination: restore Lactobacillus reuteri, the ATCC PTA 6475 strain. I'm sorry.
Well, they'll rewind. They'll write it down.
Okay. Lactobacillus gasseri, the BNR 17 strain, and that strain of Bacillus coagulans. Now, what we do is we co-ferment them as yogurt, but use extended fermentation. As you ladies know, microbes don't have sex. There's no male and female microbes. One microbe reproduces itself, become two, like that. Well, so reuteri doubles every 3 hours at human body temperature. So we allow it to double 12 times. We perform flow cytometry, a method of counting microbes, on the yogurt. So we get about 300 billion. So we're increasing the counts 100 or 1,000 fold by extended fermentation. It looks and smells like yogurt, but of course it's not yogurt. You can't buy it in a store. And we have it with some blueberries or chia seeds, whatever. And we're seeing reversal of SIBO.
Wow.
In over 90% of people. I did not expect that. I did this to maybe help people deal with some bloating or diarrhea. I did not expect SIBO to go away in the majority of people. And we know that, by the way, because of the availability of the consumer device, the AIR device. Okay, so you know. So AIRE measures hydrogen gas. So I look at these devices as mapping devices. They tell you where in the GI tract microbes are living, because they're not supposed to be. Fecal microbes not supposed to be in the 24 feet of stomach, duodenum, jejunum, and ileum.
It's really incredible that, we have this technology now where we're able to see this, because I'm sure, Dr. Davis, without this technology, we wouldn't be able to have these conversations about where the different strains are in the intestinal tract. Because as you mentioned in your book, a colonoscopy can only show so much and an endoscopy can only show so much. But there's a very large portion of your intestinal tract that can't be seen from that scope.
And even today, if Chris went to her gastroenterologist and said, "Hey, I think I have SIBO," and most of them will say, "No, you don't. You've been consulting Dr. Google again, haven't you, Chris?" Or, "I didn't see anything on the colonoscopy or the endoscopy." You don't see it. You can't see it. And so this has been neglected for it's starting to get some traction, but they're still talking about if you even get tested for it. Most of them don't even know how to test it, but or don't want to be bothered because they're too busy charging a lot of money. It's worse in the US, right?
Of course.
It's much worse here. But they're too busy doing their procedures for a lot of money. They can't be bothered with your health. So that's why it's a great time, because now the wisdom on how to do this, if I said you can get rid of SIBO by removing the 24 feet of your small intestine, well, Katie would say, well, you would be damn confident that's true, right?
Yeah.
But what if you can get rid of your SIBO by making something that looks and smells like yogurt in your kitchen? Well, now the threshold is so low, so safe. And by the way, I call it SIBO yogurt, and I regret calling it that because it makes it seem like it's only good for SIBO. It's not. So what we're really doing is restoring what are called keystone species, very important foundational species that when you restore those microbes lost because of all the things that disrupt your microbiome, it brings back other species too, allows other species to proliferate because it's bringing back order by reducing the populations of those fecal microbes.
Now, I have a question here, which kind of is timing out well. Is I recently did a GI map and found that I'm riddled with SIBO and H. pylori. So this is a great chat for us to be having. And of course, I've been really digging into your book, and mine comes from, I've had H. pylori for quite some time, but I believe, the SIBO was a combination of after I had 2 late pregnancy losses in 2019. And after my DNC, they watched me take like a quadruple dose of antibiotics in the hospital. And since then, my gut has just been a disaster. And I, being a practitioner, I just didn't have time to go and sort out my own health. So now that the symptoms are so bad, I've decided to really, focus on my gut, get the microbiome, and work on the SIBO. So you're saying I'm going to go and make myself some yogurt this weekend, the recipe that you have, and that's going to be a great addition to the SIBO protocol that I'm working on. So now I'm really excited, to be honest. Like, your book couldn't have come at a better time for me. So I'm really excited to be able to dig in and follow all of your, be one of your own clinical human trials over here in Canada. So
She's really good at this, Dr. Davis, her own human clinical trial.
So I'm wondering is, when you call it a SIBO yogurt, how does it fare for those that have a dairy intolerance?
So several things to know. When we do extended fermentation of dairy, and I use organic half and half, because I also reject this idea that we should limit fat in any form. Well, saturated fat and total fat. So I use organic half and half. The extended fermentation maximally reduces lactose and converts it to lactic acid. And the acidification, the pH is about 3.5 compared to 4.5 of conventional yogurt. So tenfold more acidic. It is tart. With that degree of acidification, also denatures or breaks down the casein beta A1 protein of dairy, so it's much less immunogenic. So we haven't eliminated the problems with dairy, but we've minimized a lot of the problems. But you could still use goat or sheep or A2 dairy, or you can use coconut milk. If you use canned coconut milk, you just got to make sure there's no additives like gellan gum or xanthan gum. We do add guar gum, as it's a prebiotic fiber, because coconut milk likes to separate. And you get a big layer of fat and layer of protein. So we have to add guar gum. There's a couple other steps. It's all in the Super Gut book, the additional steps to go through. I'll tell you one thing. There's debate on whether you should get rid of H. pylori.
Interesting.
I think it's wrong. I think if you have H. pylori, you must get rid of it.
Yeah.
Yeah, because I've seen this happen too many times, Katie. Somebody has H. pylori and the doctor says, no, it's not bothering you, right?
Yeah.
He said, no, I feel fine.
I got that.
Well, here's what happens over the years. You get hypochlorhydria. You get a loss of the capacity to produce stomach acid. Once you have that, you can never regain the capacity to produce stomach acid. It's kind of like type 1 diabetes. You never get back the capacity to produce insulin. So once you damage your parietal cells that produce insulin, you never get it back. And then you're going to have essentially intractable SIBO that won't go away. So there's some debate. People like Martin Blazer, for instance, Columbia, says things like, having it can be an advantage in your immune response. There's a little less asthma, pardon me, in children who have H. pylori. Now, when you have hypochlorhydria, it's the precursor also to stomach cancer. So weighing all things, I would get rid of the H. pylori. And by the way, there's a whole bunch of strategies in the Super Gut book. One of the great things in the world of H. pylori is that because of the failure, the resistance that H. pylori is so good at generating, and the increasing failure of the conventional antibiotics for H. pylori, there's been a lot of evidence on alternatives for getting rid of H. pylori. So you now have a ton of great choices, and we've been eradicating it very successfully.
I know. I was reading in your book in the it was at the appendix of the resource section, and I thought it was really interesting reading your studies of what you utilized with your own patients to eradicate the H. pylori.
It's quite easy, and I believe it's more effective than the conventional antibiotic cocktail.
Right. And that's the other thing, Dr. Davis, is like we were saying earlier, is over 90% of our clients come in on long-term antibiotics. And we say long-term, like 7 years straight of antibiotics. So when you hear things like 7 years straight of antibiotics, what goes through your brain?
Well, we know they're going to have SIBO, and we know it's going to be really, really bad. So those people, so that SIBO yogurt I told you about,
Mhm.
we typically do it for 4 weeks. And then we continue it intermittently afterwards, maybe 2 or 3 times a week,
Mhm.
because SIBO loves to recur. But people with that kind of a history, they almost always have to take the SIBO yogurt for many months
Ongoing.
that they have it. Yeah, and only then. Now, how do you know the SIBO has receded or is gone? Well, one way would be to test with the air device,
Mhm.
hydrogen gas. Another way would be to watch for what phenomena you're experiencing. So, if you're experiencing fat malabsorption, for instance, so fecal microbes in the duodenum block the action of pancreatic enzymes and bile, and you can't digest fats, and you see fat droplets in the toilet.
Mhm.
Another real common thing is food intolerances. People say, I can't eat nightshades. I'm on a low FODMAPs diet. I can't eat histamine containing foods. There's nothing wrong with the food. There's something, you have SIBO.
Mhm.
And if you, let's say you can't eat eggs because it gives you stomach ache, asthma, skin rash, whatever, or you can't eat tomatoes because they give you bloating and diarrhea, blah, blah, blah. Well, try after 4 weeks, you can try, take a little bit of one of those foods and see if you respond. And you can see if you're now tolerant.
Mhm.
And so, food intolerances are very, very common sign that you have SIBO. And when it goes away, the food intolerance goes away, it's good evidence that you've conquered your SIBO. Now, the intolerance of food, there's a timing issue there too. That's often not talked about. If you eat something that makes you sick and it happens within 90 minutes, it's virtually guaranteed that you have SIBO.
Mhm.
Because if let's say I eat some tomato and if it's going to cause gas or bloating after 90 minutes, that could have happened in the colon. That's okay. That's not, it's not perfect, but that's not SIBO. But if you eat that food and it causes gas, bloating, diarrhea, depression, suicidal thoughts, anxiety, whatever, within 90 minutes, that means microbes are living high up in the small intestine. That tells you you've got SIBO.
It's fascinating, right? Like, Chris, we have clients that come in that are riddled with food intolerances. And I often find on Instagram and my DMs, I have people saying, no, it's just the food that's causing my acne. And we're like, it's not the food causing your acne, it's your microbiome and what's happening in your digestive system that's causing the acne.
Very
Especially
good.
that immune response, right? The circulatory IgA, the mucosal barrier, when these all get compromised, the intestinal permeability, and then traveling of the toxins through the blood system. I mean, it's really easy to get acne. It's really easy when our food that is supposed to be absorbed and assimilated in the intestinal tract now is free floating and, causing invaders. And, one of the big things I also see is when people come in and they're like, I mean, Dr. Davis, you're going to probably understand this wholeheartedly and confirm that, you add a little bit of indigestion and heartburn. Here's your proton pump inhibitor. See ya. Have fun. You're going to further suppress that stomach acid. You are just creating the beautiful breeding ground for the H. pylori because it is resistant to hydrochloric acid. It has that resistant strain. Now you've just said, hey, I don't have to fight for it. I say to our clients, how many times do you let people come into your house, live for free, cook for them, pay for all their bills? I said, that's called children, isn't it? How many children do you really want living in your home? Right? These types of things. So why are we allowing all these people into our body, right? That's ours. That we're supposed to claim host for this. And if we're more bacteria than anything else, you better be giving yourself some little TLC, right?
I'm sure you two see a lot of this. People say, well, if I don't eat such and such, my acne gets a little better, or my gas and bloating is a little bit
Mm-hmm.
better, or whatever. And I don't want to talk about the SIBO. It's too scary. It's too difficult, right? Well, not a good idea, right? What are the consequences of uncorrected SIBO? Because just eliminating that food does not correct the SIBO. In
Yeah.
fact, it can make the situation worse. So if you don't correct the SIBO, you're opening yourself up to weight gain, obesity, increased potential for type 2 diabetes, um, increased potential for coronary disease, atrial fibrillation, fibromyalgia, depression, cognitive impairment, Alzheimer's dementia, Parkinson's disease, psoriasis, rosacea, colon cancer, diverticular disease. In other words, multiple sclerosis, you're asking for trouble. It may take some years before you have those things appear, but there's going to be trouble ahead. So it's very unwise to say this is too scary. Now that I think we have this kind of yogurt type of solution, I don't, it's not as scary. It's easy to do.
It's not as scary at all. And what's interesting there, Dr. Davis, as you started listing all of those off, is, after back in 2019, I had these antibiotics, my digestion went off, and my nerve pain intensified tenfold. And doctors kept saying, you have fibromyalgia, you have fibromyalgia. And I'm like, that's not a diagnosis. It's a set of symptoms. What is causing the set of symptoms? And it was so fascinating to me when I was reading Supergut is you said 100% of fibromyalgia sufferers have SIBO.
Yes, if we believe Mark Pimentel's evidence. So Mark Pimentel is one of the great researchers in SIBO and gastrointestinal. He's at Cedars-Sinai at Los Angeles. And in his trial, he did a trial, very interesting. He generates very high quality evidence. Took something like 100 people with irritable bowel syndrome, 100 people with fibromyalgia, and 100 healthy controls, and then test them for hydrogen gas production. Well, the people with IBS, 84% tested positive for SIBO. Of the people with fibromyalgia, 100% tested positive to a severe degree. And I've seen this play out in real life. People who have fibromyalgia, we correct it. We correct the dysbiosis and the SIBO, and their fibromyalgia recedes.
Isn't that incredible? And it's so interesting because I feel like a lot of our society doesn't connect their gut health to all of these other symptoms that they're experiencing.
Absolutely. It could be cognitive impairment. It could be suicidal thoughts. It could be, for me, insomnia. So one of the great effects of the reuteri for me is, so I'm a chronic insomniac, struggle to sleep, have for decades and decades. Melatonin,
everything.
Tryptophan, all
you
that
name
stuff.
it, you've probably had it.
With reuteri, I sleep all the way through. Deep sleep with vivid childlike dreams. By the way, as an illustration, just how powerful microbes can be. I combined it with a microbe called Lactobacillus casei, C-A-S-E-I, Shirota. It's a commercial product called Yakult. It's an awful product. It's sugary skim milk. So we take that sugary product and we ferment it as yogurt. Well, when I did the combination of Lactobacillus reuteri and Lactobacillus casei Shirota, I was sleeping, a chronic insomniac. I was sleeping 12 hours a night or more. I had to stop it. The effect was so profound. But it
works too well.
But sleep's good. Sleep is also connected to the impairment in the perpetuation of that SIBO too, right? Like it's all these cofactors. Like, please, everybody, as you're listening to this, I'm kind of drooling if you can see me on, because I'm like, Dr. Davis, keep talking like you're just preaching what we love, right? Like it's all full circle. So,
a big sleep disruptor, of course, is inappropriate surges in cortisol.
Right.
So we're supposed to have a morning surge that helps arouse you. And a lot of people, especially if they've been exposed to stress, have mistiming, circadian dysrhythmicity. That is, they wake up at 2 or 3 in the morning, they can't fall back asleep, their heart's racing. And so one thing I don't know how to do is to shift the timing, but we can suppress the surge. And the two that are most effective, to my knowledge, are Lactobacillus reuteri, Lactobacillus gasseri, have been shown, good evidence, to suppress that excessive cortisol surge.
And I feel like we're going to sell out of reuteri everywhere. Everyone everywhere is going to be going to buy reuteri and stocking up on it like it's toilet paper during COVID. And pretty much. And I would love for you to answer this question because it's something that we talk about quite often with our own audience and our own clients is, will probiotics alone fix your gut?
No, in fact, it's the last item on the list. Because most probiotics are formulated like this. They say, okay, this microbe is injured, throw it in. That microbe has some, throw it in. They're haphazard collections. It's going to get better. So one of the things that has not been done is to incorporate what are called guild or consortium effects. And all that means is putting together microbes that work together as a community. So it's one of the reasons why if your mom gave you Lactobacillus reuteri at birth and breastfeeding, you'd have it for a lifetime, barring exposure to antibiotics and other things. But if you get it, say, as a probiotic or as a yogurt or whatever, or a fermented food, it takes up residence for a few days. Well, why? Well, probably because we didn't restore the entire community of microbes. So the probiotic of the future will likely be something like this: Lactobacillus reuteri with 5 other species or whatever that work together via metabolites. So current products, there's only one group of products from a company called BiotiQuest, BIOTI Quest, and they do incorporate some effort at collaborative effects. My friend, Dr. Raul Cano, is the formulator for those products. And there's a lot of nonsense going on in the probiotic world. Some of it for competition. It's a crowded world. For instance, some products will double encapsulate so that it's released into the colon. Now, wait a minute. If half the world has SIBO in the small intestine, why would you delay release into the colon? You want release into the small intestine. And then, of course, sometimes the inclusion of microbes that don't do very much, like Lactobacillus acidophilus. So there's a lot of issues with it's going to get better. But right now, when people want to reimplant healthy microbes, first thing you do, well, first of all, remove things that disrupt it. Stomach acid blocking drugs, buy organic foods, filter your drinking water, avoid processed foods with preservatives and emulsifying agents. So all clean up your life, and then plant seeds with fermented foods, kimchi, kefirs, yogurts that you make, not the stuff in the store. Veggies fermented on your kitchen counter. For listeners who don't know how to do that, it's very simple. It's in the Super Gut book. There's people like Donna Schwank. There's companies like Cultures for Health and Cutting Edge Cultures. You can buy starter cultures. So easy to do and inexpensive.
Yeah, I love that. Those are some really great and easy tips that people can absolutely do at home.
And you know what, Katie? It's one of the most powerful things people can do for skin health. They don't think of having kimchi or sauerkraut for skin health. But what happens is you get the microbes of fermented foods. These are species like Leuconostoc or Pediococcus. These are microbes that don't take up residence in the human GI tract. You ingest them and they go from mouth to toilet, but in their passage through the 30 feet of your GI tract, they act like little farmers for beneficial microbes, the ones that, for instance, produce butyrate, the butyric acid for your skin. And so the fermented foods, one of the most important things people can do for skin health and appearance.
And it's incredible, right? Is simple things that you can be doing every single day. It doesn't have to be these massive, big, crazy, trends and celery juicing and all these fads that you see on social media. It can be these really, really simple things. So, Dr. Davis, thank you so incredibly much for joining us today. My first tip for everybody is go and buy Supergut. If you do not have Dr. Davis's book yet, Barnes & Noble, Indigo, Amazon, add to cart. You will love it. Now, Dr. Davis, I would love if there was one parting thing that you would love for our audience to really take away. What would that be?
Don't make this tougher than it is. It's really quite easy. Adding back fermented foods, culturing or fermenting some of those important microbes like Reuteri, Gasseri. I think it's not a stretch. We're talking about better GI health. We're talking about thicker, smoother, more youthful skin. We're talking about a return of youthful musculature, an increase in libido, increase in testosterone for males, improved reproductive health for ladies, empathy, generosity, acceptance of other people's opinions, reduction of social isolation, reduction of social anxiety. I mean, this is not just less bloating or less diarrhea or less constipation. We're talking about, I don't think it's a stretch to say this is life-changing, and it's easy, and it does not have to involve the doctor or the hospital.
So we're saying SIBO yogurt for world peace.
I like that.
That's going to be the new slogan of Supergut, everybody.
Okay.
That's the next edition.
That's
Very good.
That's the revised
We're waiting
edition.
for it. We're waiting for it.
Good idea.
Thanks so much, Dr. Davis. We really appreciate you joining us today.
Thank you, Katie. Thank you, Chris.
All right, everybody. That was another wonderful episode here on the Clear Skin Chronicles, and we will see you next week.
Thanks for hanging out with us this week on the Clear Skin Chronicles. We'll see you next Wednesday with a brand new episode. Remember to subscribe to the show and drop us a review. Sending glowing vibes your way, Katie and Chris.